CVS and Walgreens have announced that they will be limiting purchases of pediatric pain relievers. Cases of respiratory infections in children are on the rise, and both stores say stocks of some medicines are in short supply due to high demand. I want to bring in Dr. Shannon Dillon now to talk about this. She's a primary care pediatrician at Riley Children's Health in Indianapolis. Dr. Dillon, thank you for joining us today. And I've been seeing in stores like CVS, there are no children's medicine available, Tylenol, anything. What can parents do if they can't get their hands on medication at the pharmacy? Do you recommend any tips?
Well, the first tip would be to look around at other stores. There's not a production shortage, so it's not that we're seeing that there's no medicine. It just may not be in the store that you're in. So looking around somewhere else is always a good initial step. Parents should also talk to their children's doctor about whether their child might be big enough to take a pill, whether that would need to be crushed. But since most children's medications are dosed based on weight, you would want to make sure that your child was big enough to do that. We do recommend talking to your child's doctor before giving any expired medications because that may not be safe. And also, parents should feel more comfortable letting fevers ride. Fever is part of how the body fights viral infections. And so if your child's temperature is 99 or 100 or even higher, but they look good, really people could feel more comfortable not giving medication than many parents do.
That's a key piece of advice. Let the fever ride. I had not heard of that. And I'm just wondering, for parents who go to the store, your child is sick, you're stressed, you see that the shelves are bare, what should they not do? You know, I can see a parent turning to Amazon, try and purchase this stuff online. What options should they avoid?
That's a great question as well. One option to definitely avoid is never to give a child aspirin. It can be misleading that there are medications labeled baby aspirin, but it just means it's a small dose. It doesn't mean it's for children. Giving aspirin when a child has a viral syndrome can cause a rare condition called Reye's syndrome that can cause inflammation in the liver and brain. So that's never something that we recommend in children. You can use a lukewarm bath to help cool down your child, but we don't recommend using a cold bath because if it's cold enough that it can make them shiver, that can actually raise the body temperature even further.
And Dr. Dillon, children's pain relievers and fever reducers have been clearly in short supply for weeks now. Why would you say that is?
Well, we've been seeing more sick children this winter than we have the past few winters because all of the measures that we took in order to help mitigate the COVID pandemic helped lower the number of other respiratory infections that we saw the last 2 winters. So we're simply just seeing more sick children than we usually do this time of year. It's not that they're getting sicker, but more sick children means more people who are trying to fight infections and needing to lower fevers and have pain control.
And we forget, I guess, because we've all been masked up, we haven't built these immunities to some of the very basic, flu viruses that are bouncing around. We're not parents, but we're trying to empathize for those who are and who are really worried right now. For those parents who are just feeling a little anxious, you got the holidays around the corner, the kid is sick, you're stressed out. What's your best advice to the parents out there right now?
I am a parent and I completely sympathize. It's hard watching your child suffer when they're not feeling well. I think the first big thing to remember is that most children do really well with viral illnesses, and so they're going to get better very quickly. Make sure you're talking to your children's doctor. They want to help you out, and they are a great source of information and much safer for what's appropriate for your child's age than simply going to the internet. And then also to remember that the best medication is prevention. And so if you haven't yet, considering getting either your flu shot or your COVID booster so that even if you do get infected, it's much more likely to be milder is the best medication that we have out there.
That's good. And that's reassuring for parents too. I would advise folks to share this clip. And I like that advice to let the flu ride. That's the kind of parent I'll be.
Right.
The kids will be sick of you gotta let it ride. Dr. Dillon said you'll be fine. Don't worry about it. You'll bounce right back. Dr. Shannon Dillon, thank you very much for joining us today. We appreciate it.
You're welcome. Have a good morning.